Thanks for watching AM Northwest this morning. You know, weight loss tops the list for many of us when it comes to New Year's resolutions. So here with help, we welcome back from aesthetic medicine, Dr. Jerry Darm, along with weight loss patient Terry Misley. Good to have you both with us. Terry, first of all, you lost how much weight?
A little over 100 pounds.
Wow. And what was there one day that you said to yourself, I've just got to lose the weight?
It actually was December 13th of 2013.
What?
I have a annual Christmas party, and I couldn't have it because I couldn't put up the Christmas decorations, wasn't able to really do the hosting.
Because the weight was holding you back?
I physically wasn't able to.
You're talking really just a year ago this weekend.
Yep.
And you've lost 100 pounds in that time.
I've lost 100 pounds since February, but that was the defining day. I just didn't know where to go. And my primary care physician had recommended gastric bypass surgery, and I was like, no, that's not what I want to do. And then January, I went and got my hair done, and my hairdresser, I didn't even recognize her. And she told me about Dr. Darm and his program. She had lost 75 pounds, and she, just was it was just amazing. And so I went in, I scheduled an appointment, went and saw a nutritionist there, learned about the program. I actually did quite a bit of research, and then decided that this is what I wanted to do.
And how do you feel now?
Awesome. I went to Hawaii in June to where I was able to not use a seatbelt extender.
Great.
Put my arm rest down. I was able to go scuba diving, snorkeling, kayaking, play with my nieces and nephews on the beach, which, 2 years ago or even a year ago, I wouldn't have been able to do
I'm
that.
exhausted from your trip just hearing about it.
Yeah.
Dr. Darm, you hear these stories a lot. It's got to, be gratifying that your program and the solutions
it's a medical alternative to some of the surgical solutions, as she's alluding to, and it's very Spartan. I mean, we use the diet shakes basically 5 a day, and the patients are medically monitored, very closely. We do blood work, once a month, and we do the EKGs frequently, and they see the doctor, every month at least. And so,
now, explain why that's so important. Being medically supervised while you lose weight.
If you're taking medications, if you're diabetic, for example, a lot of times the diabetic meds go away within 2 weeks to 4 weeks. So there's pretty drastic changes. The blood pressure drops, the cholesterol drops. So, we have to really monitor these things carefully, especially in a program like this where there's, a pretty significant amount of weight that's being lost.
Terry, why do you think it worked for you?
Well, what it is it is a structured program, and it's a very supportive environment. So once a week, from 11 o'clock to 1:30, my team at work know that they can't reach me. And I go to a weekly nutrition class where I'm learning behaviors to help me change my life. And by doing the shakes, it basically allows me to not become overwhelmed, so I can learn those behaviors and make changes both mentally, emotionally, and physically. And then I start seeing progress, which then is more encouraging, and then you start picking up the physical activity. And just really the environment is so supportive. And the other clients are in the class is just great.
What do your friends say to you?
Well, a lot of them don't even recognize me.
Wow.
Yeah.
That's the best compliment.
Yeah. And my husband, he basically is saying, he feels like he has his wife back because I'm able to do those activities.
And I'm noticing your ring is on a different finger. I'm guessing it doesn't fit your fingers anymore.
No.
That's something, isn't it?
Yeah.
Well, amazing story. We want to let folks know if they want more information about aesthetic medicine and weight loss programs that they offer there. Give them a call, 503-697-9777, and we'll have a link on our website at katu.com. What a great story. Thanks for sharing.
Thanks.